Good afternoon, Afreen, Harti, Lekhya, Rohini, Roshni, Shruti, Ashwini. Shruti again, Nanda, thank you for joining in. Pawan, thank you for joining in. Let me know if you can hear me. Loud and clear. Put in the chat box. Good afternoon, Afreen, Harti, Lekhya, Rohini, Roshni, Shruti, Ashwini. Okay, thank you for confirming. We'll go live in another 2 minutes from now. Stay connected. Good afternoon, everyone. Just checking if you can hear me loud and clear. Please confirm in the chat box. Yes, thank you. All right. Okay, so here is Chandrika for you. Hi, Chandrika. Good to see you. You are on mute.
So glad that we connected, and I must thank Bhavik. So through him, I got this great opportunity to meet you.
Yeah, I must thank Bhavik as well. Yes, Bhavik was, we got connected on LinkedIn, and I was asking, a lot of people are asking for, session on medical coding. What do we do? I'm looking for some people, but some speakers, but I'm not getting. So he said, okay, wait, I have somebody, I'll share the details. And that's when he shared your contact details, and we are here. So welcome, Chandrika. Thank you so much. And
thank you.
Yeah, thank you.
I must thank you as well for this giving. You did not judge me on my experience or something. You just gave an opportunity. So I have to say this. I have to express my gratitude and thank you so much, Manoj. And I must also say about you, and actually we must thank you because nobody put so much effort to create such content or to create this kind of awareness. So you are doing this, and I personally I took it as an inspiration, and I thank you.
Thank you so much, Chandrika. Thank you for that note. And then, yes, we begin with today's session. These sessions have been happening since June 2021. We'll be completing 3 years close to coming June on 5th. Yeah. So thank you again. So with a short intro about in Chandrika, let's begin with that first. I do this as a ritual in all my sessions. So Chandrika is a proud medical coder. She started her journey after her degree in biotechnology with Vee Technologies, where she joined as a trainee. And this is very important note. Why? Because many students today they feel not so good about joining as a trainee, right? And being joining as a training is absolutely important, because when you join as a trainee, you get connected to so many opportunities later on, and you are a real live example with us today. So Chandrika joined Vee Technologies as a trainee after her graduation, and she applied her skills, knowledge, and dedication, of course. She quickly climbed over the success ladder and got promoted as a senior quality analyst. Yeah. So she has been working as a senior quality analyst at Vee Technologies, and she has got a certification. The certification is CPC certification. She'll talk more about that. And this certification is one such certification that demonstrates the proficiency of medical coders. And if you have this certification, then this field definitely has good opportunities for you. And then she is also a lifelong learner. She is on a constant learning mode, and she keeps helping other people, other professionals who want to get into medical coding. She also maintains an Instagram page where she creates good content on medical coding. She inspires wannabe medical coders, and a lot of people are learning with her today through her videos and content. And she wants to train a lot of medical coders as well. She will talk a lot about that in her journey. Of course, I don't want to share everything, so that she also gets a chance to talk about her story. And she loves to help people who want to get started in medical coding. There are a lot of myths and related to joining as a medical coder. There are a lot of content available online. There are a lot of you know uh, wrong stories on medical coding also online. So, Chandrika is here to share all her learnings, all her journey on medical coding. She'll talk about the overview, future prospects, certifications, careers, and also share her story. So, Chandrika, welcome to the session. And I hope today's session will inspire many of not just pharmacy, but also life sciences graduates who are constantly on a mode to get into medical coding. So thank you again for this, for agreeing to be here, and let's begin.
Yeah, sure. We'll begin with the presentation.
Of course.
Let me share my screen. Is it visible?
Yes, perfect.
Okay. So today we are here to discuss about what is medical coding and the overview, the future, and the opportunities and the certifications. So first, let me the myths. What they people think is medical coding. They will at first when I joined medical coding, take it as my story. I soon after finishing my graduation. Today, my last exam got over. I had a plan. I knew about medical coding, and I was focused. Okay, one sector is there where I can easily get into this job. So I planned medical coding, and after the my last exam, still result was not yet out. And then I applied. I went to walk-in interview. I got selected, and 3 rounds was there. I cleared all the three only with my confidence, not with anything other else. Like I did not know too much anatomy or physiology. They believed in me, and I got selected. There was like 1 month training period was there, where they insist on medical coding and what they do, everything. So in that 1 month, I know I used that opportunity well, and after 1 month also I got the assessment I have cleared, and I get into floor. So after once I got in floor, I got to know what we are doing, what medical coders will do. There will be many things. There will be many other sectors in medical coding, and we have to choose wisely. What we are going to do is important. It should be, what we do is like it should be in a learning phase also. Every day we should keep learning. We should not stick on to the things that we know. And if we start ignoring, anyway this concept is, I knew about this concept, okay, let me, that thing will not we should not let our mind to accept those such things. So we should be in a constant learning mode, and we should keep our learning curve active. And then, but after that, every 6 months, after 6 months I got confirmation as a coder. And soon after, in before 1 year, I got promoted as senior medical coder. After that, quality analyst, and now senior quality analyst. So as I am keep on learning, they started believing in me, and they are giving all this opportunity where I can express all the skills, and to put my knowledge, in the all the, I cannot mention all those. So just it's going well. And I what I believe is, we have to be stay focused, and we should be a constant learners. And anywhere, if we are getting any kind of opportunities, we should accept, and we should prove that we can do this. Simply without accepting the opportunity and telling ourselves, okay, this maybe I cannot do, that's the biggest failure. You have to try, and then you have to decide, okay, this is not my thing. If you are not trying, and if you are thinking that, okay, it might do this, that, it's a failure. So if you want to be successful in this medical coding career, you must be career oriented, and you should not take breaks until at least 4 5 years of experience. If you are going to take break in middle, like, okay, 2 years, I will do medical coding. After that, oh, I'm not I'm not liking this medical coding, or I'm not liking this job. Some, you might feel like it is a difficult or anything later, up to you. Actually, it depends completely on you, how you utilize the project, or how you will learn. Everything depends on you. Somewhere, if you feel like, okay, I cannot, I have to give up on this, like after 2 years, don't do that. You have to, somehow you have to make it at least till 4 to 5 years of experience. Later, no one will consider you as a medical coder. You will be assigned with good works. But if you take after 2 years of break, and you will give 1 year break, and 2 years of experience, and you will take 6 month 1 year break, and again you have to start your career in medical coding. Those 2 years experience, no one will consider. Again, you have to start from the scratch, because this medical coding is every yearly wise, there will be many changes. So no one will consider you as an experienced coder or experienced person. They will treat you as a trainee only. So you have to be focused when you are choosing medical coding. And if you are a final year students, or recently passed out graduates, you should know what you have to do. It should be in order. Either you have to take certificate, or either you have to choose the company where certification is not mandatory. And later, once you hit the floor, you can plan your certificate, and you can with work, you can develop your skills. So those are the two aspects that one must do. So this is all about my story. I have included all. And to conclude my story, I must be grateful, and I am grateful for the people I have met. I believe that right people, we should encounter right people at the right time. Then only there, with the proper guidance and proper direction, will lead you to some kind of success, or you will not get fail in life. So I have that personally, I believe. And I'm grateful for them, whoever I met, and my office or my organization, the opportunities they gave, and the belief, everything. I will assure that I'll keep the trust, and I will work towards my organization as well. So this is all my story. So let me begin with medical coding. Sir?
Yes, Chandrika, that was such a wonderful one. And definitely you said rightly that, once we get opportunities, we have to get them, we have to show our worth. Because unless we show our worth and we keep waiting for the best opportunity, see, I'll tell you what I have observed in the pharmacy profession, even I was one of them. To be frank with you, we keep waiting for all the planets to align and then we want to start something. Okay, that's a very wrong notion. There is nothing called as perfection. We should just begin somewhere. We should keep learning, and learning is a continuous process. It does not end with a degree, right? We should not think that, okay, I have done my master's and I have done my graduation and yeah, that's it, so I don't want to learn. That is never the case. I have been in medical writing for 15 plus years now, and every day it's a learning process. Just few minutes before starting this session, I was attending one more webinar on medical writing, so I was just learning from the speakers there. So it's a continuous process. It's a continuous. Perfect, go on. Thank you so much.
Yeah, and one more thing is like the graduation and the master, they believe like, okay, after graduation they have to choose masters. Once, like, every family will not be financially strong, and they, right, not everyone can support their children, so that you have to plan, okay, am I good at academics or am I good at making money? So if you think like, if the money you need and you are not focusing on academics, that is there is like, you have to quit your education and you have to start focusing on where you will get money. That's what I did. I did not go, my parents will do masters. No, I was like, I was not good at academics. Why I should make, go and sit and not learning anything, that it will go waste anyway. I will have those 2 years. If I get work, the 2 years experienced will I will get. So that's motivated me, and I hit the floor.
Absolutely. Yeah. And most of the experience we get on the go, right? On the job.
Yes.
Yeah. So we should always focus on that. Yes. Perfect. Thank you. Go on.
So
yeah.
So today's agenda is my story I have discussed, and what we are going to discuss is what is medical coding and who can be a medical coder. What do medical coders do? What they do is important, and which companies hire medical coders. I mean, I have put some best companies, and what are the certifications for getting into medical coding, and who provides these certifications, and what kind of packages do medical coders get, and AI in medical coding. This is a big questions that I will explain. And finally, I will left this question for you guys. Is medical coding is good career? So all, listening to all the points, that is up to an individual, that you can choose on your own. If you think like medical coding is good, you can go ahead. If not, there is no force to it. So yes, next is, I have discussed my story. So leave about. So we came to the main chapter. So what is medical coding? So what is medical coding? Medical coding is a process of translating medical diagnosis, procedures, and the treatments into universally recognized alphanumeric codes. So these codes are used to various purposes, including billing, reimbursement, medical research, and healthcare analytics, and maintaining patient records. So what is medical coding is, this is a medical coders, they have to translate medical diagnosis, procedures, and treatments. So you will get a medical chart or medical EMR. So what you have to do, you have to read the document, and you have to select the diagnosis. What is diagnosis? Anything that patient come for. He might have fever or something else. So you have to pick that, and what services the provider rendered to the patient. That is important. So what procedure, they might given a nebulizer for cough. So that procedure we have to convert into code. And then what treatment? So provider might have given injection to the patient. So the particular injection code we have to, the treatment we have to make it in a code format. So this is what medical coding. Totally, it is, we have the process of translating medical diagnosis, procedure, and treatments into universally recognized alphanumeric codes. So why they are saying universally recognized alphanumeric codes means, it is universally published, all the medical coding codes. So each course will have certain value, certain dollar value to it. So our job is to read the document and take the procedure diagnosis and convert into code. So this is what medical coding. I hope everyone has idea. And next we'll see. So what are the main things which involved in medical coding? So these are what in medical coding we use CPT, current procedural terminology, and ICD-10 CM and HCPCS. And also we will use ICD-10 PCS. So these are the books. And if you are 1 minute, I will. Sorry about that. Okay. So we will use for diagnosis, we will use ICD-10 CM book. And for the procedure, as I discussed, injection, I gave an example. For that, we will use CPT manual, and whatever the drug and the supply material, like for suppose the patient is patient needed wheelchair. Okay, that kind of supply material will comes under HCPCS. Using all these codes, we will conclude, finally we will having the knowledge from CPT, ICD-10 CM and HCPCS. The medical coder, will get all the knowledge from this source, and he will finally, he or she can do the process of converting, as medical coding says, translating the diagnosis procedure and diagnosis procedure and whatever the service we have to convert into the code format. So these sources will help you. So firstly, for diagnosis, we have ICD, International Classification of Disease. As name says, these whatever the codes comes under ICD, this is all for diseases. And the next is current procedural terminology, that is CPT, which is like it is all what the codes comes under CPT will be applied to procedure codes. And HCPCS, as I mentioned, we will use HCPCS codes for drug material or supply material. All those comes under HCPCS. So this is a small overview. So why medical coding? Why did USA they are doing medical coding? So why they started? Because medical coding serves a standardized language that enables the healthcare providers, insurance companies, and other stakeholders to communicate effectively. The use of codes allow for accurate documentation, classification of medical services, ensuring the consistency and facilitating efficient data management across the healthcare industry. So these medical coding have a track on healthcare industry. They doing this medical coding things, they have the raw data, like how many, everything is in order, organized, and it is going in a securely manner. So it serves a standardized language. That means everything like codes, we have procedure codes. And for example, if you take one particular clinic, in that clinic, how many patients are visiting, and what provider is rendering the service, what kind of service they provide, everything will be on track. And this minimalize the fraud and abuse. So this is why medical coding is there. And next, purpose of medical coding is to quality of healthcare, as I mentioned. So it includes the quality of healthcare. We'll discuss on next slide. First, I'll explain all this, and later I will come to what we do and who are all can be a medical coders. So many were asking like, is non life science graduates can be a medical coders, or in pharmacy many will be like, to be honest, if I start mentioning in medical coders, this job was mainly known from Kerala and Chennai. Previously in Karnataka, like very few were aware of medical coding job, and they were not aware who all can be a medical coders. So now 2020, after, not also 2021 afterwards, in Karnataka also this awareness got served well, and now in Karnataka also few medical coders are there. So let me explain who are all can be a medical coders. So pharmacy, nursing and life science. So pharmacy and life science graduates are mainly. So in case if you are non-life science background, but you want to get into medical coding, what is the way? If you ask me, you should complete 80 hours of medical coding program. After your graduation, you should complete 80 hours of medical coding program, and you should have the document that to show that you are completed the program, or else you can take CPC certifications or any one certification to prove that you have skills. So I mean, you're applying or writing in your resume can help you to get the job. So other than the medical coding is to pharmacy, nursing and life science graduates have completed a degree in the study of living organisms, and their characteristics they include field like biotechnology, microbiology, immunology, hematology also fine, and pharmacology and neuroscience. Anything like I did not mention everything here. Anything that comes, if you have a little knowledge in anatomy and human physiology, you can be a medical coder. So after your bachelor degree, the process I'm telling. So after either your the graduation or after your master degree, one must obtain certification, to keep you in a track. And then certification is recommended for medical coders, show their competence and dedication and organization like American Academy of Professional Coder, that is AAPC, and these are the educational bodies that I will explain. So from the certification is important. See, so here I have to tell, you have to decide, are you able to invest on certification? So certification costs too much in India. So if you are ready to invest money on certification, you can go ahead. If not, you are not sure about your career, you have to give a try on medical coding. Don't go for certification. Try search for the company where they are hiring medical coders without certification. Get into that company. If you like medical, after starting your work, only if you like your job, like what you are doing, if you have a trust in the job and your career and the opportunity, everything seems perfect for you, then you can invest the money, or you can ask your organization to anyway in almost all the organization they will sponsor certifications, so you can utilize that. So this is a thing that you people should know. And then what do medical coders do? So there are many kind of medical coders. You cannot tell like, okay, I am translating, I am assigning codes and I am translating the procedural servicial whatever the things into codes, I am a medical coder. Yes, you are a medical coder, but with you there are other sectors also, there also can be called as medical coders. So first is assigning codes, as I discussed in the first slide. Assigning codes in the sense, we have to read the documentation which sent by providers, and we have to take out what is diagnosis code and what procedure provider rendered to the patient, and then what treatment has been provided to the patient. So this is assigning codes. And next is documentation review. So these are the other sectors where the coders involved in reviewing documentation. So we will have those coders will be expertised in documentation review. We will have such formats where documentation should be in kind of there will be a guidelines or there will be a flow. The documentation should be like this. So in that process, few coders will be involving, and they will review the documentation. If any discrepancy occurs, they will escalate into provider, and they will or else they will query the provider and they will get it fixed. So if I want me to give example, For example, some will be like some other procedure. A patient came for what I can say, some irrelevant abdominal pain patient might came. Okay, the provider did leg X-ray. So how irrelevant it is. So, and that scenarios, this documentation review people, they will sort this discrepancy, why you did what kind of procedure it is. So if it is relevant, he should give extra documentation to sustain that. If not, you should agree that it is something like mismatched. So this is what documentation review people will do in compliance and regulations. It is like, it is not basic entry level medical coders cannot do compliance and regulations. It is after some kind of some years of experience, one must can get into a compliance and regulations by getting a certifications regarding compliance. So that is this will be that. And the reimbursement and billing. So here many will have confusion, like who will do reimbursement and billing and who will be doing coding. So few people get involved both coding and billing, both medical coding and medical billing. So that is called reimbursement. Few like if you take, they will have knowledge in coding also, but they will be involved in reimbursement and billing purposes. So those are the coders, comes under reimbursement and billing. And then data analysis and research, collaboration and communication, compliance audit, all this comes after entry level. So we'll discuss that. Assigning in everything this I have explained. Assigning code, medical coders review medical, including physician notes, lab result, and other relevant documentation to identify, extract the pertinent information. And they assign specific codes to diagnostics, procedure, treatments, and the service using coding systems such as International Classification of Disease and current procedural terminology and HCPCS. As I mentioned earlier, so all using all this source, we will extract the information and we will translate into code. That is assigning codes. You have to remember this. When we are assigning code, the code should be proper and it should match with the documentation, because every codes will have dollar value. So we should not affect either, it should not affect either patient or provider. And medical coders are, their job is very prominent, because once you code and submit the claim, either if you do something wrong in the while assigning, if you do something wrong, it will affect either patient or provider. For example, your evaluation is wrong. If coder miss doing evaluation properly, and he will submit some little dollar value, like 20-30 extra dollar value, he will bill the coder. It will benefit provider, but it will the patient will have the insurance and the patient will get affect. So this is why the coder role is prominent. They should be very effective in their quality, and they should maintain and they should stick on to all the compliance and the guidelines, everything. And mainly the coders will follow state-wise guidelines, not like all coders do the same thing. Each coders will have certain guidelines, and we follow particular state guidelines and particular insurance guidelines. So all based on these guidelines, the coder has to assign the codes. So I explained documentation review. You can go through this. So compliance and regulation, medical coders adhere the coding guidelines and regulations and industry standards to ensure the proper coding practices. They stay updated with the latest coding changes and updates and compliance requirements, such as those from Centers of Medicare and Medicaid Services. So from the CMS, whatever the changes happens on yearly basis, the coder must adhere to it. I mean, he or she should be knowing, like, okay, this last year we followed a different thing, but this current year some few changes has happened. The coder must analyze what changes has happened, and he or she should follow the current updates while billing or while assigning the codes. He or she should not do last year thing. So that is what compliance and regulations, the checkup will be there. If they find out, it will be an issue. So I explained reimbursement and billing. All this I have explained. You can later you can check it. We'll come to main agenda. See how everything works. I have given this flowchart here. How everything works. See, first the provider sees the patient, and whatever the thing, maybe the discussion will be recorded, and the treatment, everything will be recorded. After that, the audio or video will translate into the EMR. The documentation will be from electronically. The documentation will be available once the discussion get translate. After that, medical coder will get the documentation. He or she should review the documentation, and whatever the discrepancies, whatever the queries the coders might have, everything he or she should sort it out in the coding process, and they have to bill the services and the diagnosis and the treatment. After that, they will bill the claim. After billing the claim, if something goes wrong in the billing, or if something is the coder might have coded wrongly, after that it will get deny or it will get reject. The reimbursement will not happen to the particular claim. It will once it get reject, once they find out the coder has made some mistakes, it will get deny or reject. After the process of denial and rejection, the billing people will take the claim, or denial people or rejection people take the claim, and they will look into the claim, and they will find out, okay, what mistake coder made, and they should rework on the claim, and they should correct it. They do the adjustment of the, maybe if he might done wrong in charges, they should adjust the charges. And if some procedure is not done but coder is billed, or some discrepancy, whatever the mistakes the coder made, that completely corrected by billers. They will conversation, the billers will have direct contact with insurance people and patient. So having a conversation with the insurance, this biller will fix this claim, and again they will resubmit the claim. So this is the process, how RCM works. So coder, then billers, and then this clearinghouse. So all these are interconnected. So if it may coder do properly, in the coder level, the claim will have proper, everything will be correct. After that, for some changes, some other level of billing or complaints they might take, and they will do some changes in the claim, and it might be wrong. So all this level should be clear. After all the level process and everything, if seems correct, insurance will reimburse the money to provider. So this is how RCM works. So just it's an overview. We cannot go into deep. So after that, I have I did not to specify from India. I have taken few companies where your career growth will be good. I mean, for the learning purposes. For the 1 year or 2 year experience, you cannot expect something big. First, you should learn the basic, and you should understand the process well, how exactly medical coding is working, because there are plenty of sectors in medical coding. You cannot learn only one thing you learn and then you expect something more. That is not possible. You have to learn each sectors. Okay, I am good at this sector, let me learn this one, like that. I cannot specify all those. So once you become a medical coder, you will have an idea. So I have kept all the companies which are in Bangalore, Chennai, Hyderabad, and in India. These are few companies where your career growth is good. So Vee Technologies, Optum, Omega, all this, all companies will not work only one one sector. All these companies will have several sectors of medical coding. So some whoever get into Vee Technology, they will learn something, and whoever get into Optum, they will learn different part of medical coding. So it depends. So there is so much in medical coding, there is so much to learn, and it completely up to you how you can utilize the opportunities that you have got. So I did not work any other companies, and I cannot specify all those. So to be as I worked in Vee Technologies, I will mention few points. If you are if you want to join Vee Technologies, you can join. There is no issue in that. So firstly, I will tell how Vee Technologies works. Vee Technology will have a little more work. You should be, it is very good for the people who are, hardworking and dedicated. Because once you start working hard, you will get to learn many things. You will get to learn many things, and without doing, for example, in the early ages, if you take okay, for now graduation, you completed graduation, you are 21 now, so you can from 21 to 25 you can do your hard work. There is nothing wrong in that. If you think like, okay, I am 21 year, I am how to do this much, and if you are tend to quit your career in the early ages, it is the whole process will get stuck. Everyone will have struggles in the starting phase. You have to learn. You cannot be all the years you will not be learning. First basic 2 or 3 years you will be learning, and you cannot expect, and you cannot call yourself as a expert. You have to learn. You have whatever the struggle or whatever the difficulties you encounter, you have to accept, and you did like don't give up on the phase in the beginning stage. Once you cross 4 years of experience, you will be in a stable, and you will call yourself as a senior medical coder. Wherever you go, you will have good opportunities, and it's a stable phase. After that, you will not suffer too much, since you will be having knowledge in everything. You cannot feel any difficulties afterwards. So my suggestion is, first 2 or 2.5 years you have to stick on. You have to accept what comes, and you have to work on it. Towards medical coding, you have to keep yourself up, and keep learning whatever the new things happening in medical coding. And you always, if you want to grow in the companies, once you get into organization, you should be different from the crowd, because not everyone can be designated, right? There will be 20 members in the team. How you are how you are standing out of the crowd, that is important. How unique you are, how much knowledge you have gained through the years, so that is how it matters. So utilize all the opportunities, and make use of it. Whatever the I cannot, like, whatever the domain or the project to get into it, use try to learn more on it. After 2 years, you can choose your career, specialty career. I will explain with the certifications. So what are the certifications do medical coders have? So there are many certifications. So I have mentioned all the certifications here. Some will be for some certification for auditing level, and some certifications for compliance level, few certifications for billing, and few certification is completely for specialties. Which specialty you want to work, that specialty certification you can get. So for example, here I have mentioned CPC, COC, CRC, CIs. All these are certifications. I will explain 2 or 3 certifications here. Firstly, CPC, that will go deep and will explain, leave about it. COC, certified outpatient coder. CRC, certified risk coder, risk adjustment it will be. And CIC is inpatient coder. CPB is certified professional biller. CPMA is for auditing purposes, CPCO is for compliance, and CPPM is for practice management. CDEO is, as I mentioned, document in the previous slides. If you observe that I kept documentation review. So whoever wants to do specialization in the documentation reviewing, they can take CDEO certificate. Which says certified documentation that is for documentation evaluation. And see what next is the another important is CCC. This is also specialty certified. CCC, it is completely for specialty into cardiology. If you feel like if you are good in heart related things, you can choose specialty coding CCC, which says cardiology. And this is having a huge value, that is CCVTC. That is what is this? Cardiovascular thoracic. They will work on both cardiovascular and thoracic. They will be called as certified cardiovascular thoracic coders. And then this with the it is all specialty coding. I'm explaining all the specialty certificates. Next is another thing. See, CUC, it is for urology, and CRHS, it is for rheumatology, and CPEDC, it is for I forgot, CP certified professional, COPC, and CPCD. I have note because it is not everything I cannot remember, and I can say it is for pediatric. CPED is for pediatric, and then CP compliance. And next important here is, it depends. It is like if you are good at something, you can choose specialty. I'm telling. And then CGSE is for gastro. Sorry, CGI is for gastro, and it is for surgery. Everything which is, all these are certified in specialty wise. All these certifications are, except CPC, COC, and CRC, CIC, CPB, you can leave it. From here, all these are specialty. If you get into inpatient coding, you can take certified inpatient coder certification, and then as I mentioned, CCVTC, and these are a few important, like a few certification which is having more value. So that's what I am mentioning there. So coming to these certifications, it is we will not see much in India. So this certifications also I'll discuss further.
Chandrika, you may just stop sharing and reshare the screen. Those
Yes,
marks
yes.
will go off. Annotations will go off. Yeah. Participants, stay connected. You can keep putting your questions in the chat box. We'll take the questions at the end of the session. I'm just waiting for the slides. Yes, perfect. The slides are here. We'll continue with the session, and we'll take the questions at the end of the session. Yeah, package and other things also we'll discuss. Okay. Package is something we cannot share in public domain. We'll just have a basic discussion
just
about it. Yeah, just an overview. All right, Chandrika, thank you. Continue, you may.
So as I mentioned, certifications, we should also know about these two educational bodies from the USA. One is AAPC and one is AHIMA. So what AAPC stands for? American Academy of Professional Coders, and AHIMA stands for American Health Information Management Association. So these two educational bodies are, as a basic, it like all medical coding, the coders, whoever will be keep on learning. There will be they will completely depend on these educational bodies because they provide too much education on medical coding. So as I discussed, AAPC is more into outpatient and specialty coding certificates they will provide. This AHIMA is completely into inpatient. If you want inpatient training, I mean, if you want to get into inpatient coding, you can choose American Health Information Management Association certificates. So here I mentioned whatever this RIA, RIT, all these from CCA, CCS, these certifications from AHIMA. See, I mentioned here in this slide. See, under AAPC, the CPC, COC, all this, whatever previously I have discussed, all the certification comes under AAPC. And next is AHIMA, that is American Health Information. Under this, how many certificates? 4, 5, 7 certificates comes under AHIMA. So if you want to, like, AHIMA will be after 2 years only certificates. After 2 years of experience, you will get the certificates from AHIMA. That is like you have to choose if you want inpatient, only if you want inpatient coding, you can go to AHIMA and you can take the certificates from there. But why we are taking CPC, like everyone wish to take CPC, I will tell why. So as a best basic certifications, one individual can opt is CPC and CCS. So CPC can after graduation anyone can take CPC. So if you are a fresher and you are taking a certificate without experience, you will be called as you will be given the certification with CPC A. A stands for apparently. If you have a experience, 2 years plus experience, you will be getting certification CPC will be getting. You will not get that note A. You will not get. So that is a difference between CPC and CPC A. So that A will refer, okay, he or she should have, she don't have experience. And once you get 2 years of experience or some educational units they have given from AAPC, if you complete that, the hourly education, and if you submit the proof, they will remove this A. And if you have 2 years plus experience and you are taking CPC certification now, you can ask your organization to send a mail regarding that you have this much year of experience in the current organization. Then this AAPC will remove the that A in your certificate, and they will send one more certificate with only CPC. So certified professional coder, why everyone choose certified professional coder? Because CPC is the only certificate which includes all the old syllabus, like even you will get to know inpatient coding little and outpatient coding, everything will be included in CPC. So it is called as golden certificate for medical coders, and easily you can get it if you work little hard. And the current fees is $540 for 2 attempts, and membership you have to take, that is $190. And next, the CPC certificate is for 100 marks. You will get 4 hours duration, and one must obtain at least 70% to hold the CPC. So you have to get 70% in the CPC exam, then only you will be given with the CPC certificate, or else you will not get CPC. And so you will be having 2 attempts if you take $540 voucher. One attempt if you get fail also, second attempt you can try and you can get the CPC certificate. And what is membership? Membership is to access AAPC source. So from membership, you will be given with the unique member ID. Once you get the membership, that is, as I mentioned, $190 in Indian rupees, it almost costs 16,000. So this membership will have 1 year validity. Each year you have to pay the membership fees, and you have to get again you have to get the membership. Every year it will get expired. You have to pay the membership fees, and you have to be you can revert from the ID. You can renew your ID. So this is about CPC from AAPC. And next is AHIMA. AHIMA from CCS, Certified Coding Specialist. It is more into inpatient coding. Once, like for example, you joined one organization without any certificate, so you got into inpatient coding. Now you can choose CCS. After 2 years of your experience, you can choose CCS, that is Certified Coding Specialist, and it is offered by AHIMA. It is also having a membership. You have to, one must take membership. It costs $100, and next fees is $299. The CCS fees is $299. It will be having only single attempt. In one attempt, you should pass CCS. Then you will be getting the CCS certificate. You will not get 2 attempts in CCS. So you have to be very, thoroughly you have to practice. And once you get the confidence, you can go for CCS exam. So this is all about these 2 2 certificates. Every, like many coders will have, like as I previously I mentioned specialty certificates, right? In India, you will not get that much, not all the companies works based on specialty. They will be working in the normal ICD projects or outpatient clinic projects. So you will not be seeing more specialty opportunities in India. If you are planning other countries, you can definitely go for a specialty certificates. Whichever the specialty you are good at, you can take the specialty certificate and you can try a good job. So how much you can earn? This is left to you. How much can medical coders earn? This is I will mention with the basic salary, but it is not mandatory that you should okay, they are fixed some 23,000. Sorry, some for certified coders, they are in many companies will give. It depends. You have to research where like coders are getting more for non-certified also and certified also. So as I know, the basic salary starts from 21,000 to 25,000 for non-certified. Certified range starts from 23 to 28,000. So this is how in India it's going. And after that, it is up to you how much. Every organization will have incentives. Every organization will have OTs. It is up to you how you can earn. Like whenever the like for example, if I give an example, means in the COVID crisis, there were like a huge volume, because COVID, the pandemic happens in this small clinic. For example, in the one clinic called A, for that clinic, some 10 members, hardly the 10 patients every day visits we were getting. But suddenly after COVID, for the 10, I'm telling in a number, the 10, whoever the patient, the clinics which we were seeing 10 patient a day started seeing 150 plus, 150, 160, 200 patients per day. So this is how the volume increases when the flu season, or in the USA, like some rainy season or some weather, due to some the calamities, natural calamities, volume goes up. So you will be given with more work, and you should be able to work, and you should be able to finish the work. So they will be having more incentives, and you will be having OTs, Saturday, Sunday. You will be getting more. If you, for example, if you take 20, you got a CTC like 27,000 or 25,000, and you are working 2 hours extra a day, not 8 hours. You are working per 10 hours, and in the weekend you are working 1 day. So you will be getting around 10 to 12,000 extra money in a month. Not the, so it is up to you how everyone, like you, if you want to earn more, you can work 2 days, and you can work little 3 hours extra a day. So it is purely based on you. In India, I am saying. And I will also tell you how to other countries and the opportunities. So this is the basic salary in India in the almost all organizations are giving. And the next big question is AI going to replace medical coders? So is it true or false? Is anyone answer? What's your belief? Yesterday also I got 2-3 message. I am afraid that I got certificate and I spent too much money on certificate, but now they are saying AI is going to replace medical coders.
So one question, one answer is maybe.
Maybe.
No, there is another one. No, there is another one. No, I don't think so. One more, it says yes, it may be possible. Gaurav says it will help as a tool. Murnal says might be. So it's a variation, a lot of varied responses.
Yes. No, we cannot say might be also. Like all coders will not get replaced. It is highly impossible because there is nothing, more powerful than human brain, as everyone says. There is a saying that what is that? AI will not replace you, but will replace AI person. Like whoever depends on AI, there's a high chance that they will get replaced. But medical coders, you cannot. Even if you try ChatGPT also, it is updated till 21 only. Like our medical coding things. After 2022, we have many changes. 2023, we have many changes. Those whatever the changes happened, you cannot find it in ChatGPT. And also, we will work on state guidelines and we will adhere to HIPAA. HIPAA cannot be a public, and we will be working on protected health information. That is like, it is a very crucial, very secure thing. Everything we cannot disclose. So the coders and the clinic, the coder, the provider, and the insurance people, these three bodies only will have the access to know the guidelines and to know the format, how they want the reimbursement, how they want to bill, everything. So this the tool, as someone mentioned, which it can only helps us. Like some will be automated, like we already using such softwares where everything picks and coder has to evaluate. But whatever it picks, if we cannot, there will be for one procedure code document, the provider will document this much big thing. That much we cannot give ChatGPT. You have to read all this. Only one word they will specify. If it is one word, it is there. This AI should pick the code. But we cannot rely on single word and we cannot trust AI. So it is highly impossible that medical coders are going to replace. Only they will take it as a helping tool. That's all. So this is a big question. Maybe I have answered. And the next is, so as I mentioned, is medical coding is good career. So we cannot assure you, because each individual mindset is different and each individual skills are different. So I cannot say like you can go to medical coding and you will have a bright future. It is completely up to you, up to individual. If you have the stability, if you are career oriented, and if you are ready to learn everyday basis, you can choose your medical coding as your career and you can go ahead with the medical coding. And also I want to specify medical coding and medical scribing. Many few people will get confused between this coding, billing, and scribing. So scribing is completely different. The scribing who can do is registered, whoever like having more knowledge, they can do this. Registered nurse, maybe in pharmacy, all they will be having. So the 4 years of education they should have. Those kind, the students can opt scribing. Scribing, what they will do, they will be with the physician. They will be in the operating room. They will sit behind, or they will be with the physician, and they will start evaluating, like, okay, provider is doing this procedure to patient. He has to note it down. This procedure, okay, infusion started at this time and then infusion ended this time. So everything the scribe has to be with the physician, and he or she should write it down. I mean, make a format. So this is how scribe do the job. But coders, as I already mentioned, we will get the documentation. So we will review on the documentation. We will not be with the physician. So this is the difference between scribes and medical coders. And next thing is, yeah, as I mentioned, is medical coding good career. It's completely up to you. If you are ready to take a medical coding as your career, you can choose. So I guess question and answer session now. We'll see what questions comes up.
Yeah, perfect. Thank you so much, Chandrika, for that wonderful session. And a
Welcome.
lot of things I was even not aware. So, for me, medical coding was a completely new thing to learn today. And thank you so much for those learnings, new concept. And I'm sure I'll watch this video one more time to, learn few more concepts. There are so many technical things for me personally. And I'm sure a lot of, insights our participants also got.
Okay.
So regarding medical scribing, you were saying medical scribing, we did a session, full-fledged session. There is a, pharmacy professional who's doing medical scribing from Kerala. Yeah. Nisha, and she did a very good job in justifying what medical scribing is all about. I'll put on the recording link here in the chat box for all of us. So all of you who are interested, that you can just bookmark this and then watch it later on. Medical scribing is all about, doing live, interaction. So doctor is interacting live, you are listening live, and you are, entering the details into the software live. Everything is live. All right, so let's get back to our medical coding session and let's have some Q&A session. Okay, so all the participants, if you want to ask question, there is a rule here. Rule is you raise the virtual hand on Zoom, and you can unmute yourself. If you want, you can also switch on the video. We'd love to, see people around us. We are seeing both of us together right now, but if you are also on the screen, definitely it will help us. So you can unmute and you can ask your specific question. So raise your virtual hand and then let's see who is the first. So Chandrika, you may stop sharing the screen. Let's have people on screen now and let's answer the Q&A. Yeah. All right. So we have the first question coming in from Bhavik. Yes, Bhavik. Yes, good to see. All right, let's see. Bhavik. All right, Bhavik, good to see you. Thank you. And he's the person who, because of whom this entire session has become possible. Bhavik introduced me to Chandrika, and Chandrika is here for the session with us. All right, thank you, Bhavik, for that. And let's have the question from you.
Thank you for, completing that wish of mine also. So thank you, both of you. So my question was related to medical coding, specifically in UAE or some abroad country. What would be my path after CPC, the certification exam? What should I do? Should I go for an internship or should I go the job route? Could you elaborate a little more on that? Thank you once again. I'm really to see ma'am face to face or video.
So, Bhavik, you mentioned, so you are planning CPC in June. So what you have to do is, you have to, before taking a certificate, plan. If you want to go to Dubai, I mean UAE country, if you are planning, this is what you have to do. You have to use your LinkedIn, list out all the hospitals and clinics, which the particular, if you want Dubai or Abu Dhabi, where you are going, in the specific location, which hospital, which clinics, whatever the pharmaceutical, the medical, the maybe whatever it is, you have to list it down. Okay, start following them in LinkedIn. For example, Burjil Hospital, and Burjil Hospital is connected to VPS Healthcare. Okay, so if you start following Burjil Hospital, you will find the people who works there. So these are the things you have to make contacts before your certification. Once you get your certificate, you start approaching them that this is my certificate, and then I am planning UAE. So can you help me? Because once we have a contact, it is easy to get. Okay, after that, if you want to search job in UAE, you should not search as a medical coder. In UAE, no one will call you as a medical coder. So they will call you as a insurance coordinator or claim specialist, claim officers. So all these words they will use in UAE. So search job based on this, or else you have to search job in CPT, ICD, HCPCS. These keywords you have to put and you have to search. After that, you can take some 3-month visa and you can go to UAE. And as I mentioned, everything you are listed, like the hospitals, you have to keep checking the jobs. Wherever the walk-in interviews are there, you have to go and you have to attend. In UAE, it is like you should be having more knowledge in anatomy and physiology. So as you are already a pharmacy background, you will be having all this drug details, everything. So you can easily get it. Either you will be assigned as a scribe or maybe insurance coordinators. The paying will be very good. So within 3 months, I can assure you, you will get the job, because there will be plenty of job opportunities in UAE.
Even for a fresher?
Yes, it will be there. Certification is important.
Yeah, only after certification.
Yeah.
Thank you.
Certification, and don't hesitate to venture as a trainee. Many times, I have interacted with so many pharmacy students, and they don't want to get into as a trainee. All they want is a full-time job with guaranteed salary, 5 days a week. It doesn't work in real life. Okay. So getting into as a trainee is perfectly fine. Even if you don't get paid for some time, it is okay.
Sometimes, yeah.
Just get into as a trainee, learn something, get a certificate from them, get interaction, make some connections, talk to people, and this is going to help you a lot. All right.
Sure. All right. Thank you so much.
Perfect, Bhavik. Thank you so much.
Than sitting, for nothing. So that is what like some trainee jobs. Okay, few people how they will think is, okay, I did masters. Why should I be choosing this, and I have to make my profile down? So that is not the case. Even if you go 1 year, 2 years without job, so rather than being not like jobless, you can get something and you can learn.
Absolutely. The visit visa would last only 3 months. So if after that the job is not secure, then what that could be a thing. But yeah, I get it. Once you have the exposure into that company, we can obviously put that as into a resume. And then what I'm supposed to say is, few people will think is like, they will be knowing few designations, like the pharmacy. They will be searching the jobs in this, what is this? I am not sure. The clinical, the laboratory, research and development, and from drug pharmacy, the pharmacology, pharmacist, something related to drug. So they will be specifying, they will be looking for these kind of jobs only. They will not try, they'll not search, okay, what are the jobs can pharmacy students can do.
Yeah. So we need to get into non-conventional jobs also. Yeah. See, we should not just think about the conventional things. When I was doing my graduation, my B.Pharm, I had only 3-4 options. One is get into teaching, get into production, get into QA, QC, or open a medical store. Even today, I see a lot of pharmacy students have the same mindset. Of course, there are maybe 100+ opportunities, but we are still thinking in the same mindset. We should just open up and look at the different opportunities that exist. All right. Thank you, Bhavik. Let's take some other questions. Okay. So I'll read out one question from Bhavna. Bhavna says, I'm a CPC certified coder with life science graduate, and I'm looking job about on specialty, but most of the companies are asking experienced professionals only. Can you suggest me the companies who take freshers?
Yeah, as I mentioned, Vee Technologies will take, and then like you have to be specific. You have to be keep on following the whatever the companies. As for people like you, I have mentioned all the companies. You start following them in a LinkedIn. Using LinkedIn is very important. Like we should only applying this, see there, you will see like, okay, this company posted one job, let me apply. Even if I tell this company has a job opening, they will ask me for the link. Okay, how to apply. You applying resume, there will be 100+, 500+ application will be there. In that application, they have to sort your application. It is a huge process, and your resume might get missed in the process. So what you have to do, if there is a job vacancies there, start seeing the employees work there, just directly approach them, send the resume to them and ask, see, I have seen in your organization there is a opening, so please refer me. So everyone will having referral bonus, each employee will have that benefit. So definitely they will refer you. So once they refer from the organization employee, you will be having more chance to get a job. So this is what you have to do. One, keep after certification, don't sit like, okay, I got certification, someone will call and someone will hire. That is not the thing how it works. You have to stay connected, just to put some effort, like 3 to 4 days. If you start doing this, you will definitely get a job.
Absolutely. Yeah, I totally agree with you. And we did a lot of sessions on LinkedIn as well. So, just in case you have not watched, participants, you have not watched them, please watch on the YouTube channel. The recordings are always there. All the recordings of all the webinars are there. So you can just go search for keywords and learn for, on different topics. Yeah, LinkedIn is a wonderful platform. In fact, I got my second job through LinkedIn. I worked with so many clients across the globe through LinkedIn. And all these webinars, you see all the speakers that I connected, everything is happening through LinkedIn. Yeah. Every single speaker I got connected I have been connecting only through LinkedIn. And most of you also joined through LinkedIn, right? So it's a wonderful platform. All right. So we'll take some more questions. In case you have questions, please raise your virtual hand on Zoom. You can unmute, you can directly ask Chandrika. And remember, if you ask, you get answer. If you don't ask, the question always remains in your mind and you'll not get answer. So don't think that it will be a stupid question. Even if it is a stupid question, don't worry, please ask. No one is going to judge you for those questions here. We are all learners at the end of the day. We have come here for learning, and ask your question. Okay, so always ask the questions. In case you don't want to ask your question, you can also put in the chat box. Let's take some questions from there. All right, so there are some questions. Package we have already discussed. There is one question from Rabbani. Which country is best for coding in abroad, like Canada, USA, or Dubai? You want to say something on that?
Dubai.
Dubai. All right. Okay. Pawan has a question. How to create code to explain? Could you share some examples? So you said about alphanumeric codes, right? So do you have any example to show that? Maybe.
Okay. Yeah. I will take one. I will share my screen and I will take one blank screen and I will explain.
Yeah. Please do that. Thank you. All right, participants, please watch how the codes are created in medical coding. Yeah. Any questions, please keep asking in the chat box and I'll take them. Or else you can also unmute yourself, raise the virtual hand, I'll unmute and then we can talk. You can use something called as whiteboard, or maybe you can use a blank PPT, that is also fine. Whiteboard is on Zoom, so you can use whiteboard also. Yeah, this is also fine. So Chandrika is giving a demo of how the codes are created in medical coding. How do we get started? She'll explain. Until she prepares, I'm just taking for her.
I have ready medical in my thing that I can show them later, but as of now I will just mention. So patient will walk in, just I'm giving patient is walk in clinic. So okay, let's take an example. Okay, she's having abdominal pain. She's having abdominal pain, and also I'll explain laboratory. So, and also she's having vomiting, dizziness, all the symptoms she has. Okay. Next is the plan. What provider will do? This is how the EMR look. Next they will do physical examination. So in that physical examination, all the 8 things, the organs, respiratory, they will do everything, digestive, all the systems they will evaluate. and they will make abnormalities. Sorry, they will mark abnormalities where in what organ system they find abnormalities. So that is what document in physical examination. So finally, they will do if something they need labs, some procedure. Okay, for example, here let me say like she is having missed period. She is missed periods. So this is also is mentioning. So she as the patient is, I'm taking she female. So the now if you're thinking right, she's having missed periods and she's having vomiting, abdominal pain. So the provider has to do pregnancy test. The pregnancy test lab code is 81025. They will not mention 81025. They will mention pregnancy test. And after that, they will mention result of pregnancy. So result is may be positive, may not be negative. Okay. So let me take it as negative result. Negative result. After they did the lab, they found out pregnancy is negative. Okay. Assessment, they will do finally treatment. That is plan. In that plan, they will say like, okay, you have a negative, your results are negative, you're not pregnant. So just for abdominal pain and the vomiting, nausea, they will suggest some anything, some one prescription drug or OTC, the drug they will prescribe. This is a treatment plan. So what, from seeing the screen, just okay, for example, like let me as abdominal pain, she's suffering from abdominal pain. Doctor gave one injection, ceftriaxone. They gave ceftriaxone. Okay, for that there will be a drug code and the admin code. If it is intramuscular and oral, whatever the routes they are administrating, we will have separate code. Let me take like ceftriaxone intramuscular. Intramuscular, they have injected. So seeing the documentation looks lengthy, as each whatever the things they have given, everything will be documented. So as you mentioned, how ICD CPT. So see here. So this is diagnosis part. If we are seeing the disease here, she is having abdominal pain, also having vomiting, dizziness, and missed periods. So this missed period, they will find out one final diagnosis. Like why she is having this some one DX the provider will give. So for example, here I am saying abdominal pain. If I want to take abdominal pain, there is a code for abdominal pain. So I have to give the code. My job. Okay, she came for abdominal pain. This is chief encounter. I am going to give abdominal pain. So in that abdominal pain, there are types. Epigastric pain is there, lower abdominal pain is there, upper abdominal pain is there. We have to specify. If they mention she is suffering lower abdominal pain, I would have given another code which specify lower abdominal pain. So next here in labs they did pregnancy test. As I mentioned, procedure codes come from CPT section. So CPT section, I have to check what pregnancy code is. I know the code 81025 is a pregnancy code. After that, here the results, I got negative result, right? To show the result is negative, I have to bill at 3202. It is ICD code for pregnancy negative. And then plan, come to plan. Here they injected ceftriaxone. Ceftriaxone is a drug which comes from HCPCS. In the first slide, I mentioned the sources. So from HCPCS, I will take the drug code, that is ceftriaxone. Ceftriaxone, I will take the code, and then intramuscular, the injection code also I have to bill. So because both injection and the what drug they injected, both I have to specify. So for injection, I will give this CPT code, and the drug I will give the ceftriaxone drug code from the HCPCS. So you don't have to by heart any CPT or ICD codes. Everything will be handy. Everything in your software, whichever you will work, like in whatever the organization, what project might be, everything will be in software. You don't have to memorize all these codes. After working on, you will get a few codes get registered. You don't have to see the software also, because everything will be in your mind after some experience. So this is how you will take. As I mentioned, ICD is for disease, and this is lab CPT from the procedure section from CPT, and the drug section from HCPCS. So when you have the knowledge of all the things, it is easy to document. As simple.
Perfect. So there is another question connected to that. One is, of course, you already answered. Do we have to remember the codes? The answer is no, we don't have to remember the codes. The software takes care of that. We only have to take care of the understanding of the disease and the prescription. Once you know if you have understanding of the disease, the drugs and human anatomy and physiology, it becomes easier for you to search in the respective software, right? And the second question is, which software or platform is used for coding?
That is, we cannot specify that. Once you get certificate and once you buy membership from AAPC, if you have money, they will they will give some particular softwares to use. So other than that, in Google, for ICDs, some ICD 10 free websites are there. So some free websites will be there, that only you are allowed to use without any if you are not in organization, you cannot access as such easily. You cannot get the software's detail.
All right, perfect. So we'll take some more questions. One question is from Nanda. She says, Nanda Kishore, my training will complete in next month. What is the best month to write CPC exam? How much time we should take the exam for? Thank you.
There is no best month to write CPC exam. Once you are prepared, you can go ahead and you can write exam. So first you make sure that you have covered all your syllabus and you are ready with, you practiced all the practice papers, series wise practice paper, and then mock papers. Mock papers, how you have to take means, you have to think like it is an exam and sit for 4 hours and do it, the mocks. After doing the mock, if wherever you are going wrong, you have to note it down. And the concept, okay, this in out of 100 you got some 60, that you will get fail. So why you got 60, where 40 marks where went wrong, all those you have to list. At least for after 5 mock paper, you should be able to score more than 80. Then you are prepared, fully prepared, and you have to manage your time, because you will be having 4 hours in exam. So make sure you are attending all the 100 questions in exam, and remaining whatever if you will get a confidence. When you get the confidence, you can book a slot and you can get the exam.
Perfect. So is this certification completely online, or do we have to?
Previously it was in person, but now it is in online mode. Like we have to go to the test. They will assign testing centers. Once the booking done, we have to go and we have to take a exam from testing. So here in Bangalore, one is in Kormangala, one testing center from AAPC, and one from Ramurthy Nagar. So either in both location you will get the slot from, if you are in Bangalore. So you can choose and go to the testing center before 1 hour. Before early, if you go, it will be good for you, because you don't know what happens in. So after that, start. I will explain this also, because many online they are thinking like, as they are attending first time online, they will not know how to flag the questions, how to go forward or backwards, everything they will be not aware. And the practitioner will just come and shows, okay, this is this, but they will be having some nervousness, and like they will might miss attending all the questions. So I'm telling, it will start in an order. From the first, it will start from the theory part, anatomy, medical terminology, compliance, and ICT questions. After that, you will have six questions from each series. In each series, you can choose. For example, in one series, you got 2 correct answer. In 4, you have doubts. So don't waste time on the 4 questions. You just have to flag the question and go to the next section. Once you flag the question, it will be there and it will be highlighted. Attending after all the 100 questions, you will be having some half an hour left. In that half an hour, you come back and see the flag questions, review it, and whichever you're not able to find the answer, it is relevant. Okay, some option is seeing relevant. Choose that. Make sure you are attending all the 100 questions.
All right. So now the next question is from Kalyani. Kindly share some interview tips as a fresher. And again, another question connected is how will we get the mock question papers?
If you once you you can get from AAPC only. If you want mock papers in CPC related thing, that is cost you around $150. You will be getting 3 mock papers. You can purchase from AAPC and you can work on it. And rest in other institute, if you are joined in institution, they will definitely give you mock papers and practice papers. You can work on that. And what the first question was? Interview questions.
Yeah, how a fresher can start. Can give some interview tips for a fresher.
Interview tips. It is every question. They will start with your the introduction and the thing. So this finally it depends on how confident you are. Like, are you able to learn what they will teach you? That is what matters. That is what they will see. And even if you don't know, you can directly say, no sir, I have not studied. So if I get an opportunity, I will definitely study. So what question they will ask? They will ask you few anatomy questions and one organ system. They will explain one organ system. This is a must and should question. Any organ system, respiratory, digestive, any system, cardiovascular, one system, you can, how it works, you can explain. After that, if you are certified, the question will be more from medical coding, like ICD, what is the code for this hypertension, what is the code for diabetes, how you will code, the guidelines, everything they will ask for certified coders. If you don't know anything about medical coding, you know only your graduation, then they will ask the graduation final year, whatever they learned, like explain this gram staining, explain some any one lab test. They will ask and they will check. I have all the questions. If you want, you can reach. I will share you that.
Yeah, definitely. So another thing I forgot to mention here, I'll be sending the LinkedIn profile link of Chandrika to all the participants. And if you're part of our WhatsApp group, then you'll also get the details in the WhatsApp group also. So do connect with her later on, and you can discuss further. And we plan to do more of these sessions, so we'll definitely plan something for medical coding. Yeah. One more question I'll take from Lata. She has this question. She says, as a beginner, can we start with IPDRG coding? Please let me know.
No, you cannot. For a beginner, you cannot directly go into IPDRG because you will be not knowing ICD PCS. So if we will learn only ICD 10 as a beginner, ICD PCS is the codes for inpatient where IPDR, that the project, they will access this usage of ICD PCS codes. So once at least the basic coding knowledge, after the getting the basic knowledge, you can try for IPDRG. There will be a specific IPDRG training centers. You can take the training and you can try. Once after your certification, IPDRG training centers are there. You can take training and you can show that you learned, that the hands-on experience should be there for IPDRG. If the institution provides that, you might get the job.
Perfect. That was a clear-cut answer from Chandrika. Thank you, Chandrika, and thank you, Lata, for asking that. I'm sure a lot of you have a lot of questions in mind, but somehow you're not asking. And I see this in every session. So you'll have questions, you'll not ask, and then one fine day you'll message me that I want the answer. Now the speaker is here, she wants to answer the questions. Please ask questions, okay? All right, Chandrika, we have some more time. Can we take some more questions?
Yeah.
Okay. So Ajay says, which specialty is good in medical coding?
So firstly, we will go with the outpatient. As we in India, outpatient is having like more job opportunities because they will not do specialty coding much. So outpatient, in that outpatient, we can choose evolution and management, and then HCC coding, that is IRR category coding, and then next is one will be like completely ICD coding, one will be include, as I mentioned the demo in the one, will be having ICD, HCPCS, and CPT. So this kind of projects will be there. So to know that outpatient ENM is good, and if you choose inpatient also fine, but it's up to you how you are make yourself better.
Absolutely. So whatever confidence you have, whatever area, therapy area you have more confidence, maybe you should suggest, we should suggest to take you that area. That is very important.
Yes.
More knowledge, right?
Yes.
One question we'll take from Sarayu. I have completed my advanced course, but because of passing out year, I think there is no chance for me to. Okay, something I didn't get. Okay, I have completed my advanced course, but because of passing out year, I think there is no chance for me in Episource. I think I need CPC certification. Do you get that, Chandrika? Or Sarayu, if you are here, maybe could you raise your virtual hand? I'll unmute you. You can ask the question directly. Sarayu, Sharayu, are you there? Just you can ask the question directly. Just unmute and ask the question directly. Don't worry. Sharayu, I've given you the option to unmute. Could you unmute? Okay. Let's go to, okay. Sharayu, are you there? Yeah, okay.
Yeah, sir.
All right, go on.
Are you able to hear me?
Yes, loud and clear. Go on.
Okay. Sir, is it possible to restart my career at the age of 30 in medical coding? Do you have any opportunity?
Okay, Chandrika, she's 30 years old and she looks like she had a break in her career. So is it possible for her to restart her career in medical coding? What is your suggestion?
She can restart. If she gets certificate, it's better for her because already she's having the break. So if somebody asks what you are doing in this time, you can answer like I have focused in family and I have to restart my career as I took certificate. This all the excuses she can easily give, and she can restart her career. No issue in that.
Yeah,
Yeah,
absolutely.
ma'am. Actually, I think there is age criteria in companies like Episource and
Don't stick on to episodes only. Just you try other companies
yeah,
as
Vee
well.
Technologies also, yeah.
There are a lot of companies, Sarayu,
What?
and you could just give a try. Yeah,
Yes.
don't worry.
Why they will take the age criteria? Why it matters? Because I will give you an example. See, I am not married. I am like from this 20 to 25 age. I will be fixed for work. I will not get any other circumstances where I'll leave a job. So even if they trust, I will be working for an organization till 2 years. What happens after 30? If they gave you opportunity, you are not sure. After 6 months, you might have something comes in your family. You might leave the job, or your husband will go somewhere. So you have to relocate. All the circumstances they will think, and they will not take a chance, and they will refuse you. But if you are already everything, your family is sorted and you are settled now, and your location is this, now you have to restart your career. You can just try other companies as well, and use that 1 year or 2 year experience that you previously worked in medical coding, and show that you have this knowledge. You can work, no issues.
Yeah, perfect. Thank you for asking that question, Sharayu. We hope we could answer. Thank you, Chandrika, for answering that. Let's take one more question from Bindu. I have completed my medical coding training and now I'm preparing for CPC certification. Can I complete my certification by preparing at home? Is the question.
No, already medical coding, this program completed.
No, she is preparing for CPC certification. Training she has
Yes.
completed. Yeah, now she
Yeah,
wants
she
to prepare.
can. She whatever the practice papers, whatever the mock papers they have given, you should work on that. From everything, self-study is like materials, the source, everything source will be there. Why you can't study? You can easily everything series wise. You have to practice. After that, once you complete series wise, you have to go to mock papers. Plan everything syllabus. You plan according to your convenience and complete your syllabus. Whatever the doubts you may, if you have a chance, if you any doubts, you can ask me. I will answer you.
Yeah. So to all the participants who are planning for CPC certification or any coding related training, please reach out to Chandrika. She'll be more than happy to help you out. She has already agreed to help everyone who's interested to get into medical coding. Yeah. All right. So we'll take one more. Yeah, this is again connected to the previous question. This is from Snehal. She says, please suggest me how much time we have to take for preparation for CPC exam.
Again, if you are able to do 2 practice paper in a day, it is okay. Like if you are able to complete only 1 practice paper a day, you have to plan. Okay, 3 papers I complete 1 day. I know all the concepts. It's completely depend on you. So take time. Don't skip. As I mentioned, every syllabus, whatever they mentioned, the CPC criteria syllabus is there. Everything you should complete. Later that, once take mock and once you get the confidence, you can book a slot. That is what I am saying. If you have any further doubts, as my own WhatsApp number also there, you can reach me out. I will explain. I will, or else I will give a timetable.
All right, perfect. So we'll take one more. Which projects are best and has growth in future? This is from Ashwini.
ENM is best because ENM has varieties in that. ED is there, inpatient coding is there, outpatient is there. So ENM, evaluation and management, is must. One should learn that. And after that, ICD, if you are coming, if you are good at ICD and you have taken training, good at, you have understandings in ICD, understandings is well. Now in India, HCC projects are more. How HCC works is, they will, it is like hierarchical conditions category. So what they will do, based on what is that severity, they will make one group in the process. So in HCC, it is in Bangalore or in India, more projects are there based on HCC. So you can go for it also. And evolution and management, as I am evolution and management coder, I will get to know all the things. If you are HCC coder, they will not aware of CPT and HCPCS. But if you are a ENM coder, you will be get to know all the minor procedures, whatever. If you will be having knowledge in anesthesia, you will be having knowledge in what is this digestive system, you will be having knowledge in cardiovascular, all the minor surgeries, dental, everything includes in ENM. And you will get to learn ICD as well and HCPCS as well. So I prefer ENM.
Perfect.
And HCC, as the coming to job opportunities, as you are a beginner, to get a job, HCC you can try.
All right, perfect. So thank you so much for answering that, Chandrika. What is the scope for getting a remote job for a fresher? This is from Kalyani on YouTube.
Remote job, as I say, medical coding is completely based on integrity based, because we will be handling with too sensitive informations. We will be having access with the patient information, identity, everything. It is completely compliance based. So in India, how they will prefer and give the opportunity, like work from, if the employee is trustworthy, they will give work from home. And if they don't expect any threat or any some inconvenience from them, they will definitely give. But as she mentioned, as a beginner, what you have to do is, as before I mentioned, like for Bhavik, I have told you have to charge once you certification in your hand, start searching your job in LinkedIn like remote jobs. Remote jobs in USA, they will provide jobs, entry level jobs. You have to search in the first. You have to put worldwide. After that, the seniority you have to choose entry level. As you are beginner, entry level. Any job opportunities which are remote and which is in worldwide, you can apply for those jobs. And if you are luck, if you get one, it is well and good.
Absolutely. Thank you.
But you for your for your learning purpose, I am saying don't expect work from home in the beginning stage. At least you have to go to office for 2-3 years and know the domain knowledge, everything, and after that you can be work from home employee.
Yeah, again, this question, comes from almost all the areas in medical writing. They ask, pharmacovigilance, they ask, everywhere they ask this question. Freshers, especially, ladies, especially, they ask this question that can I get a work from home, as a fresher? So the answer is no. Most of the companies, they, face the integrity issue and ethics issue, when they give the projects to people to work from home. Only when you work with the companies for quite some time, let's say 1 or 2 years, the company knows you as an employee, they know your attitude, and then they'll decide to give you a work from home. That again, as an in conditions, right? They'll agree with you, they'll discuss with you, and they'll give you all the instructions. Only if they are convinced, they'll give you an option. Otherwise, in most cases, it is no. Right. So once you have 4 or 5 years or maybe 6 years of experience, then yes, there is very high chance that you can work as a consultant, you can work as a freelancer, you can also work from home as a full-timer. A lot of people are working. I know a couple of my friends, they are working for US-based companies, completely full-time work from home.
I am from working from home.
Yeah, Chandrika herself is working from home. So yeah, there are many such people who are working from home. But then we have to show our worth to the company. The company realizes that yes, this person can do the work, and there is no problem giving the confidential data or information to this employee. Only then you get that chance. Yeah. All right. One last question we'll take from Ashwini. The question is: can medical coders work in hospitals? Yes.
As I mentioned, yes, you can work as a scribe.
Yeah.
Scribe. If you have like you have only BSc nursing, it would be fine. If you have a graduation in nursing, you can work in hospital. Other than for life science like biotechnology, without hospital knowledge, you cannot enter, I guess.
All right.
All
Perfect.
medical coders cannot.
All right, perfect. So thank you so much, Chandrika, and thank you so much, participants, for being with us. We spent close to 1 hour 45 minutes. All these learnings happen like this. We don't understand what kind of time we are spending here. One session we spent about 3 hours 15 minutes. Learning on medical writing. So this continues. Thank you so much, Chandrika, for your time. Thank you, everyone, for your time. And I hope this session was useful. We had a lot of learnings. I personally had a lot of learnings from Chandrika today. And definitely I'll continue to evolve as we continue to interact further. So to all the participants who are joining from YouTube, you already know the link. To all the participants who are on Zoom, you'll be getting an email from me, or if you're on WhatsApp, you'll be getting the LinkedIn profile link of Chandrika and also the recording link of the session. Soon after the session ends from my side, I'll be sending the details to you, and stay tuned. We'll again meet very soon. Chandrika is here to help you, get into medical coding, and she's here to provide you with the resources. We'll also try to share. I'll also discuss with Chandrika later on if she's okay. We'll share some resources for you to continue your learning on the WhatsApp group we have. Yeah. So thank you so much, everyone, and let's meet next week again. Next week, we will be talking about medical marketing writing. So this is another very important career option which is available for all of us, medical writing or medical marketing writing. So we'll be focusing on medical marketing writing next week. In case you are interested, do follow on. You'll be getting all the details on my LinkedIn profile and also on Telegram if you are there. All right. So thank you so much, Chandrika. Any final words for the session today?
No, I am thankful And I will I will be happy to help all these participants. If they come back to me, I will definitely, I'll be whatever the resource or any source if you want from me, I will definitely give you. And any doubts which you are not asked here, you can ask me. You can reach out me in LinkedIn or through WhatsApp. Anywhere, I'll help you out. And thank you all for participating, and thank you, sir, for giving this opportunity.
Thank you.
And it means a lot to me. So I hope I have justified whatever the topic I have covered today.
So
And thank you all.
participants, before we end, okay, participant, please write in one word, how did you find today's session on medical coding from Chandrika? Just write in one word in the chat. Let's see how it is. And meantime, I'll ask one question from Chandrika. I have not asked my personal question to Chandrika. Okay. So Chandrika, this question, I have been interacting with a lot of ladies, who take a break after marriage. And because of many circumstances, they have to take breaks, right? So what has been your experience? Can a lady with a career break, can get into medical coding, or can a lady who was working as a faculty in some college and she took a career break because of some reasons, she can get into medical coding? And how has been your experience? And if yes, then what are your suggestions to such ladies?
First, I will say what are the circumstances that I encountered personally. So the last year been very tough for me. I had many plans that whatever the plans that I'm doing in the current year, which was planned in the last year. So to execute those plans, suddenly I got to know that my father diagnosed with a chronic kidney disease, that is stage 5. So it was I thought to give up, because somebody should be there and someone should take care. And with the work, that was the struggle that I cannot mention. If someone is suffering in the home, you cannot you cannot give yourself to the work also, and you cannot be in the peace. And at that time I really thought to give up on my career. But later I started thinking, all these my struggles goes like this, if I give up in the middle of my career. So somehow I sustained in the process, and now he is doing good and everything sorted. So I did not take the break. If I would have if I had a break, I don't know, the flow would have been like this. So even if you, I know everyone will have, no one will be having the perfect flow. Everyone will be having the ups and downs in their lives. So if you have a break in the medical coding, as I mentioned, at least take 3 months of your time, and what are the changes happened in the last years. So as you did not work in the past years, you should be aware of all the recent updates regarding medical coding, recent changes, and the areas where the changes happened, everything. If interview are asking you a question, you should be able to answer. Okay, in 2023 there is a ENM change, I know that, and these are the sectors where changes happen. So if you have this kind of attitude and this kind of learning skills, they will definitely take you. Okay, anyway, she can, from now she can definitely be a good coder.
All right, perfect. Thank you, Chandrika. So the conclusion of the session is, anyone can get into medical coding. There is no hard and fast rule. The age bar, in some companies, yes, that is there, but there are a lot of other companies who, do not have age bar. So you can try in those companies. Certification definitely plays a very big role in getting into medical coding. And if you are certified coder, you will definitely get better options, better companies, better salaries. And right, there are a lot of resources. Chandrika is here to guide you and help you out in wherever you are stuck. So please do connect with Chandrika on LinkedIn. And you can watch this video a number of times if you want to get more information, and keep learning, because learning should never stop, and learning is the only constant, right? It is the only way we can improve ourselves and we can contribute better to this world. So thank you so much for continuing with me on this learning journey. Thank you, Chandrika, and all the participants. This session will continue every Saturday at 2 p.m. So in case you're not subscribed, you can subscribe to the YouTube channel so that you get notified. And otherwise, you are following me on LinkedIn, you get information there. So thank you so much again. I'm stopping the live streaming right now on YouTube. So thank you again to all of you who are watching us on YouTube. Just in case we missed some of your questions and we could not answer, don't worry. Please write back to me or Chandrika, and we'll take those questions definitely seriously, and we'll try to answer based on our best of knowledge and belief. If we don't have answers, it's fine. We are not perfect here. We'll search for the answers, we'll find from the experts, and then we'll get whatever answers we have, right? So thank you again. Thank you so much, Chandrika. Thank you so much, participants, for your participation, active participation. And on this weekend also, you have been there with us for almost 2 hours. That means a lot to me, to Chandrika, and definitely we'll support each other in this learning journey. So thank you so much. Let's meet again.
Thank you, sir. Thank you all. Thank you.
Thank you.